Hi, my name is Ramey Wilson. I am an internal medicine physician, and I currently work as a senior advisor on knowledge management at the Center for Global Health Engagement. What I'd like to talk about now for the next couple minutes is basically give you an understanding of some of the tools and kind of the approach that we're taking at the Center for Global Health Engagement to help organize and be kind of a lead agent for the global health community in terms of sharing information and developing a community of practice, all within the kind of context of knowledge management. And so this is kind of what you can expect for the next few minutes. We're going to kind of review the requirements for DoD Global Health Engagement KM, some of the tools and the DoD approach, and then discuss how you can participate and engage and be a part of this community of practice if you choose to be, either in support of your operations or your job, or if you just have an interest within the DoD Global Health Engagement domain in order to be a stakeholder and a contributor over time. So knowledge management, as we've discussed in other venues, is kind of help get the right information and the right person at the right time so they can make the best decision or make the best recommendation. Some of this includes having an understanding in terms of what the current state of the situation is, having a shared understanding amongst different people, but also understanding what's worked in the past, what's not worked in the past, what's the direction that the enterprise is going in, who else is engaged in this enterprise or in the activities. All of that can, and then what technologies even are available to help support it. So all of this is in the realm of knowledge management that is centered on people. The idea is that it's centered upon helping a person make a decision or engage and conduct their job in a daily manner. And so the knowledge management gap within DoD GHE has been identified for the last couple of years, and that there's been some requirements that have been validated at the highest level, and that we needed to have a knowledge management system that was really focused on the global health engagement enterprise to make sure that we're learning from those experiences, that we're developing and cultivating professionals within that domain, but also that what we're doing within global health engagement is pointed in the right direction. It's focused on supporting our operational, strategic, and policy goals, and that what's done at the tactical level supports those higher level goals and doesn't potentially do harm or potentially work counter to what our goals are in the long run. And so if you think about global health engagement and what it is we're trying to do, especially in the context of the post-pandemic era in terms of building resiliency and understanding, I think, it is also important to kind of understand what global health engagement does specifically in terms of the DoD instruction, in terms of the mission of global health engagement. And so I would encourage you to not only read the National Defense Strategy and understand that we have a specific DoD instruction 2000.30 that specifically defines global health engagement as those activities and interactions, and you can read it right here on the slide, that are designed to build trust, confidence, share information, coordinate activities, maintain influence, and achieve interoperability, some of which fall within that domain of global health engagement knowledge management, especially in sharing information, coordinating activities, and then making sure that we're pointed at the right direction. And so the DoD enterprise, the Uniformed Services University, was in support of the Office of the Joint Staff Surgeon as a global force integrator, has been tasked with the goal of helping not run it, but be a lead agent and an advocate and a thought center for global health engagement for the enterprise, knowing that each service has their service-specific responsibilities. But the goal of the Center for Global Health Engagement is to help synchronize, support, and integrate those different knowledge management GHE programs and be that kind of like center and hub of information and practice, so that as people rotate through different positions or as the focus of our national policy shifts, we learn over time and we're not recreating the wheel. And so understand that the USU mission, the specific DoD instruction that outlines the mission of the university, was modified in the fall of 2023, that basically highlighted the the focus of the university through the Global Health Engagement to support the services, the offices of the Joint Staff Surgeon, the combatant commands, in order to manage, not manage, but to help focus and the knowledge management within the DoD GHE space to foster partner interoperability and also to support the global health security agenda. And so if you're not familiar with the global health security agenda, I think it is important, especially within the global health engagement domain, because it is a national policy. It's an international kind of coalition focused on, preparing and thinking about how we respond and prepare ourselves for the next pandemic. They use this kind of concept of detect, prevent, and respond, which uses an all-of-government approach. And what I think is that, we can actually use that framework to think of how global health engagement actually supports mission command, right? And this idea of what it is that we're trying to do within the military. And so I just would offer up this diagram as an understanding. I think that kind of gives a high level approach of what it is that we're trying to do with global health engagement within the DoDI, as well as how what we do supports not only public health, but also global health engagement, right? And so if we start with the idea that, we're going to be sending U.S. service members abroad, as well as other members of the U.S. government abroad, they're going to face health risks. Some of those are going to be endemic. Some of those may be epidemic or pandemic, but some of them may also be conflict related. And so understanding and using that to kind of detect paradigm of understanding what those risks are, as well as what the capabilities are for not only ourselves, but our partners, helps us understand the risks. Those risks can either then be accepted or mitigated, and they can be mitigated through either prevention or developing the capability to respond. Now, what you'll see in there is that each of those three kind of domains, the detect, prevent, and respond domains, have both, we have our own organic US capability to detect, prevent, and respond. And most of our partners or our host nations have similar, and then maybe they're at different levels of capability or sophistication or capacity. And so thinking about how, this kind of virtuous triad of, what you can understand, you can prevent. The more you prevent, the less you have to respond. The more that you can work with your partners and have them detect and prevent, the less we actually have to do it ourselves. And through the lens of interoperability, you can see that basically as we go through this cycle of understanding, preventing, and responding, and the more that we can do that with or by, with, and through our partners, the less we actually have to do it ourselves. Or it creates more capability that if we have a larger demand signal, we can do it as a whole of as a coalition or as a whole of approach effort. And so the goals of global health engagement, from my perspective, are these ideas of understanding the risks and capabilities of our partners, both in the military and the civilian capability, how their health systems work, what are the medical risks associated with deploying individuals, building capability when that makes sense, expanding that capacity, developing interoperability with our partners so that we can do things together and we can be integrated and we're not just piling capabilities on top of each other, and we can actually work in an integrated, interoperable way. And then using global health engagement to sustain those relationships, capabilities, and readiness in order to move things forward. All supporting this idea of integrated deterrence, right? And that by showing that we're ready to respond to a threat, that actually helps communicate and deter a threat or a competitor from taking action, because we know that we're ready to respond. And that if we're ready to respond with partners and allies in a way that's been validated, that further stimulates and integrates that deterrence communication. So with that in mind, what I'd like to do is kind of just show you very quickly, and then I'll walk you through a couple tools that we are developing and have developed and are continuing to develop. And just know that the knowledge management kind of program to support global health engagement is really just at the beginning. And so these are kind of the focus areas that we're going to be building different capabilities and programs on. But I want you to understand that at the middle of it is the person, right? It's the person making the decision. It's the person conducting that, who's been tasked to plan that global health engagement, who's on the ground conducting that global health engagement, or the person that's looking for, they need to make a decision about, how they allocate resources and the effectiveness of global health engagement. And so we've developed these different domains of global health engagement and activities in information, engagement, community, information, and process focus. And so we're just going to kind of go through all of those one at a time very quickly, just understanding that the Center for Global Health Engagement within the Uniformed Services University, which is part of the DoD, is designed to help try to push this forward and curate this, but that a lot of the work, we're not a large organization, but we're here to help coordinate the information and share it so that people can have what they need, but that across the enterprise, we're helping each other as a community. And so where I'd like you to start, and I'll show you the website in just a minute, is the DoD GHE landing page, which is on the Joint Staff website on Intel Link. That is a place that's specifically designed to be your go-to first place to connect, especially if someone is new to global health engagement. The focus of the initial design of that website was to be kind of a primer in terms of here's what you need to do to get started, to start movement, and just make sure that you're moving in the right direction, especially as people move in and out of global health engagement billets where maybe they're gapped and they didn't have a good turnover, or maybe they're a new position, or they've been tasked to incorporate global health engagement into a mission set and you don't have any experience. That's what this website is designed to help you connect. It's got a lot of key phone numbers of the combatant command at the GHE cells to help at least get you started so that you can connect with the right people. After that is, I'm just going to go around the horn here in terms of kind of talk briefly about each of these different mission focus. So the innovation focus, this is both this idea of research. I'll show you the website here at Global Health Engagement, where we have a Global Health Engagement Research Initiative. But while we're talking about formal research here, we're also talking about, like, what are those questions that are out there? What are some ideas that are out there? And we've started a new program called GHE Snapshots. They're little thought pieces that I'll show you as well. But also this idea of, like, we want this to be innovative. Let's think outside the box. Let's try to integrate in with other academia or bridge between our other partners. And so this idea of kind of innovation and let's push the enterprise forward. The next is engagement focus, and this is at the center especially, or at the command where you're doing specific engagements and best practices associated with those engagements, whether CGHE is helping with like assessment, monitoring, and evaluation, or is helping a service or a component actually conduct global health engagement activities. This is focused on actually doing the engagement. The next focus is one on community, and the community is really focused on two main domains. One is educating and training a global health engagement cadre, or those with different interests and levels with education and training. And I'll talk about some of those courses in just a minute, but some of this is not even, it's cross-cutting, right? It's in terms of helping, we have such a broad base of experience within the DoD, bringing those those people with the experience into a community of practice so that we can support each other, we can share best practices, good successes, and lessons that we've learned. And so I'll show you in a second the website for the community of practice that we've stood up, as well as a quarterly, what we call our peer, which is a professional exchange event that we kind of coordinate and lead at the Center for Global Health Engagement, that everyone we really would include, ask you to participate in that and contribute both to the website for the community practice and some of our events. And we're also hoping that, especially at key events, we potentially are able to have some link ups for the GHE community so we can meet each other face to face, because sometimes it's hard to do that when we're talking about a global enterprise. The next area of focus is information focused, and you can see this is like, how do we curate, cultivate, get all the information that's helpful for GHE individuals in one location, whether that's how do we find an expert, what's the current doctrine, what are the current policies, what are the upcoming events, We have a specific line of effort that I'll show you in a minute called Medical Options, which is a database of partner capabilities, but also has resources for getting more information about specific countries or health systems, and potentially a repository for AARs that are done of global health engagement activities. That's going to reside on the unclassified network, and we're currently in the process of building a parallel process on the secret network, so that some of those activities can feed into other data aggregators like common MedCop or the C2IE, or other non-medical data aggregators in order to contribute as part of the information requirements. And then the GHE activity tracker, which what activities are actually going on when and where. Right now, those are being controlled by the combatant commands, but going forward, we'd love to see some type of aggregator so that people can see what's going on in other areas. And I suspect that may be on the SIPR network, but that is yet to be developed. And right now, that's being controlled by the combatant commands. And then process focus. And process focus is really kind of like, how are we learning? How are we doing it together with others, and et cetera? So we have two other specific lines of effort: a research framework looking specifically at interoperability with our partners and allies, especially in terms of how we share information and standards, and thinking about things like crisis standards of care and support to irregular warfare. And then the idea of assessment, monitoring, and evaluation, in terms of how do we know what we're doing is what we wanted to do, what are the effects that are coming out of these global health engagements. And so while each of these are in kind of different focuses, there's a lot of cross-cutting principles within all of these. For example, the DoD community of practice is probably going to end up being the pool by which is we're looking for a subject matter expert. Locator is going to draw upon the community of practice and the networks of those within the community of practice to identify available subject matter experts, et cetera. Right? And so there's a lot of cross-cutting principles here, and the idea is that these aren't silos, but they're all working together to support that individual in the middle. All right, so what I'm gonna do is just let you know, it's all kind of started in Medical Options, which is a long acronym that talks about medical capability assessments that describe interoperability levels. It came from this, we did a needs assessment, and the needs assessment is available to review if you're interested in it. But basically, these are the key recommendations that came out of that needs assessment, and that there really needed to be a repository of health assessments that are done by military service members, all put into one place so that other people can find them. What we found, and what I found in my former jobs, is that we were doing assessments of health facilities, but then those assessments were just going to someone's hard drive or not really being captured and curated and kept for us to learn and grow. And then potentially that's a knowledge product that then can help inform levels of interoperability that potentially could target a future global health engagement if that was something that a component or a service wanted to focus on. And so that was kind of the beginning of it. And just to give you an idea of, AME and this kind of theory of change is, how you take knowledge management and global health engagement to drive this idea of making decisions better. And so, just understand that, we like within medical options and knowledge management, but medical options specifically, there's 5 specific goals. The first goal is just get all the information in one place. The second goal is to make it better, improve the quality. The third is integrate that so that decision makers have a resource. That then the goal 4 is better decision making by leaders and enabling operations. And then the goal 5 is how do we then feed that back into our understanding and include our allies and partners in that sharing so that we can feed that back in and we can have better decision making there with goal number 4. That's kind of I just wanted to share that with you and understand how global health engagement, it's not just one-off things. It's everything that we're trying to do is designed to try to make the whole system better, shared understanding, and also accomplish the missions of our combatant commands. And as they campaign, those specific global health engagement activities build upon what the objectives are over time. So I'm going to show you a couple of websites here very quickly. These are the links. I also basically the links that I'm going to show you. And so, and that's Dr. Options there. He's there to help. He's a clipboard, obviously in uniform with a white coat on, and is kind of our guide and mascot to help us through this whole activity. So I'm going to change my slide here. I'm going to show you, first off, this is the Joint Staff Global Health Engagement webpage that I mentioned that resides on the Joint Staff Intel Link website. You can see there on the left-hand side is a whole host of specific links. This Venn diagram that you see in the middle is pulled out of the DoD, and if you're not familiar with a lot of these activities within Global Health Engagement, there are links there that you can help educate yourself on those. Knowledge management is very much about self-directed learning, right? It's knowing what information you need to go collect, and then helping you access that information so that you can make the decisions or provide those resources as you need it, right? And then there's links up there to some of the key top level organizations. And sometimes just finding a phone number can be hard to do, right? To find the person that you need to ask a question to sometimes is half the problem. So hopefully this will be a tool that will be helpful. I also want to show you the Global Health Engagement CGHE Center's website. So that's also a very good resource. If you look here, we talked about education and training. We do run different classes called the Fundamentals of Global Health Engagement, which is kind of the introductory course on the basics of doing global health engagement. We do those virtually. We do them in person. I think we have one almost every month, and so we do some traveling teams and that kind of stuff. So if you're interested in participating in one of those or having your unit sponsor one, you can contact them through the website, and those that do the coordinating can help do that for you. And then there's a more advanced Global Health Security Strategies course that's done once a year, and I know that's being advertised usually 4 to 5 months before that course starts. Then obviously you can explore this website where it talks about different activities, but I wanted to specifically show you this page that talks about research, that talks about some of the research efforts, and then the publications within Global Health Engagement, as CGHE attempts to try to hopefully support your questions. And then if you go down to publications, the annual report will kind of help you understand kind of some of the things that we're doing. And then one of the new things are these, what we call GHE snapshots, which are little kind of thought pieces about different ideas that people within our center or people outside the center within the domain can contribute to. And you're invited to work with us to have one of these snapshots if you're interested, and especially if you have an experience that is very foundational to you, or you felt it was really helpful and you'd like to share it with others. Okay. The other thing I'd like to show you here is the community of practice. So this is the community of practice page. It's on MillSuite. Our goal is to get this onto a platform where people without CAT cards are also able to participate, especially our international partners. But this is the best we're able to do right now. This will be a hub of information, and we post things on here. Our goal is that this would be the place where you could go if you're wanting to just kind of stay in tune with what's going on with DoD GHE, and we would ask and invite you to participate, join this. We've actually we did kind of a soft launch on this in June of 2023, and we've had some growing participation as well as people knowing about this and so we're hoping as more people know about it and contribute to it, it becomes more of a platform for information and knowledge sharing. All right, the last major site I wanted to show you is Medical Options. This is the site that basically kind of started it all and has grown over time. So it started as a repository for partner health capabilities, and those capabilities are easy to access. You can look over here on the left side of the website and say, for example, AFRICOM. You can go to kind of survey library, and there basically, if you go to that survey library, you'll see that it basically has all of the kind of health assessments that have been done previously over time. We're in the process not only of making these available, but also tagging them with metadata so that you can search. So, for example, if you really needed to find something with dental capability, you could go to dental and apply, and any capability that mentions a dental capability can be filtered and will show up here that these assessments that were done talked about a dental capability within that location. We've also tried to include in here all the ISOS reports, and we've broken them down by capability so that they can be geolocated. One of the capabilities that we have on this website, again, is the ability to map the capability. So right now the AFRICOM map is working well, and basically you can go to the mapping site and you can see all of the capabilities mapped on a, oops, wrong button. Mapped for you here on a map, and you can kind of zoom in, and basically and then you can also change to street maps. And let's say, for example, you wanted to zoom in here. You would then be able to see, geolocated. Let's see if we really zoomed in there. What the different facilities are in that location, and basically see which hospitals are there. Right, similar that you'd find with Google Maps, but these actually link the assessments that were done either by SOS, State Department, or military units previously. So that's okay, so you can either go through the map or you can go through the survey library. The mapping capability just is still, we have a couple bugs in it. We're still debugging that with the Intel Link folks, but just know that that is available. There's also, for each of the combatant commands, there's a country pages. And so for each of the country pages, there are links there for the full ISOS reports that have been done in that area, as well as a place where units can submit to us like their AARs from GHE, or force health protection assessments of environmental stuff. So for example, Morocco, if you were to go to the Morocco page, it basically has all the ISOS reports that have been done there, some of the health threat briefs, some other resources, such as if you go to the Armed Forces Surveillance Branches Health Explorer, that will show you some of the real-time stuff that's going on. And then, we're hoping as GHE activities happening, we get AARs, that the ones that are unclassified, because this can hold up to CUI, and then the secret one can do up to secret level, that people will start sending us their AARs, and we can post these on here and people can find them so that we can grow our knowledge of an area over time. Okay, other resources within this website that I just want to share with you very quickly are each of the combatant commands. They have a page. So like if you click on AFRICOM there, they have their own web page. We've tried to put like public links, if the theater entry requirements. Basically, these are pages any combatant command can and have us put their stuff up here, and just so that people can understand what the goals are, what the missions are, what the strategy is, etc. And then from the website, you can obviously contact us, submit documents to us. We just ask that you put the classifications on them. But if you go here to like resource links, it's a consolidated area of different places where, whether it be TRAVAX, the MedCop, Prolonged Field Care, FactBook, any resource to try to find information about a country or health threat or pandemics, whatever you want to find. If you have resources that you'd like to add to this, please send them to us. We'll add them to the link. If you find a resource helpful, probably other people will too, and we want to add that to the resource. And then there's links here to the community of practice that I mentioned before. And then if you go up here to resources, just last, we did develop a sample template. So if you're looking for a template to do a health assessment of a facility. This is one that came out of our needs assessment, that took kind of the best and what we learned from doing that needs assessment into this capability template. We've already been getting some feedback, and so we'll be doing update revisions of this over time. And so this is a good place to come to get the most current template that has been out there. And if you have ideas or you take a look at it, you think it needs to have changes, let us know. I think this is going to evolve over time as the needs and requirements are better understood. So with that, the purpose of this, and so you can see there, just based on that website, thinking about the different engagement focus areas, how you get information, et cetera. We want you to, we're doing this not for us, but for you and for anybody else that's engaged in global health engagement. And so we would just ask you to communicate with us, join our community practice, think about us. If you do an assessment or best practice, share that. If you're interested in, writing some thought pieces or engaging in academic stuff, we'd like to support you with that as best as we can. And just know that we're a small organization, but the goal is the power is done by those out there. So some of the things we're trying to do is start collecting kind of case reports of like, what's your GHE story that you really want to share with other people. If you have specific GHE questions, but don't have the time to answer them, or, we're connected to the university and we have other centers. And so, we have students that are always coming to us looking for questions to answer in global health domain. So if you have questions or ideas or things that you need white papers written for, concepts, or even like master's thesis topics and stuff like that, then we have graduate students that are always kind of looking for projects. So we want to start collecting those questions and hopefully feeding that back into the enterprise. And so hopefully we accomplished our learning objectives for this time. I look forward to talking with you guys. And if you have any questions, please reach out to us. Thank you for your time.